with a local farm that provides the vegetables and a lot of the things that we distribute. There is a growing season in Maryland. So they ended up giving us our funding, I believe, around end of March. Nothing grows until May. So you definitely want to cater your funding around the growing seasons, or people will just be sitting idle. We did use the time to, organize and iron out details about logistics and all the other things with our other partners. But really, for the first 2 months, we were not able to distribute to anyone. And one of the things we wanted to avoid was enrolling families and then not hearing from us for 2 months because you're going to lose everybody. So I think that fluidity is important. And the growing season ends in the end of November too. So there needs to be contingency plans to fill voids around those two times. And I can get into detail about that a little bit later as well.
Stephanie?
Oh, that would be helpful because I was going to ask, and then I know you probably addressed it later. Like, how do you account for? Because I'm starting to work with local farmers too, right? And I've learned like everything is not there seasonally. So how does that account, and how do you work with that? So I know it's probably going to be later in your presentation. We're very interested in doing that, and then how do you keep the families engaged? Um, there as well, like if it's not the time for it to be there. But I don't want to go ahead of kind of your rollout. It was
Oh, no,
really
no,
interesting.
no.
I wanted to.
I've got no specific rollout. I just want to provide answers to any questions you'll have. So the way that we have set the program up this year is we provide fresh vegetables on a weekly basis to families as long as we can. So we are doing that right now from May to the end of November. We are partnering with Manna Foods, who provides a monthly box of shelf stable food and frozen protein. So that can continue into the winter. And what we're doing in the winter months, we also partner with Giant Foods. They have a program, I'm still ironing out those details, but they have a program where you can get a member card for families and put value on it on a weekly basis, a monthly basis, that sort of thing. So that's our intent in the winter to be able to get them vegetables. And I know that when you give those cards, you can even restrict what families can spend it on. That way they don't go buying soda and candy and all this kind of stuff. So our plan is to use some of the funds to buy those cards for the families who are enrolled. That way we can have some continuity throughout the program. So I know the big push for a lot of these programs is we want locally sourced food. We do that as long as we possibly can. But, once winter comes, a lot of the bets are off and we kind of just try to make it work however we can. And that's where Giant comes in.
How much would you say that they? I'm sorry, Shane. Um, Shanae, how much would you say like the partnership with Giant provides, like in terms of like their investment, or do you pay them to have the cards to give to the families? Is that how that works? How is that?
Yes,
How is
they're
that
still
done?
they're still yeah, they're still retailers, so they want to get paid for
Of
everything that they
course,
do.
of course, yeah.
Yeah. No, so we were partnering. So Giant is one of our partners on this, and they're helping us more with the nutritional education component. So we provide all this food, and we also have nutritional education that we provide to families. We provide healthy recipes, a whole lot of information, and they're a wealth of information in that area. They have a whole dietetics team that helps us, with content, sort of thing. But yeah, as far as I know that they have programs where you can buy their surplus. We haven't explored that yet because we really don't have a facility to store things. So we're probably going to do the cards so folks can just come buy vegetables on a weekly basis. We are in the works right now. We've applied for another grant to get a refrigerated vehicle. So if that comes through and we're fortunate and get funded, that opens some new avenues and then we'll probably get creative and find other ways to get things cheaper if possible. But not everyone is set up like a Manna that they can store things and have warehouses and all this kind of thing because you got to keep that in mind before the lofty ideas get bigger and bigger. So we need to know our limitations.
Thank you for that, Henry. And can you talk to us a little bit about how folks are referred to the program and who's eligible?
So I'll give you a little bit of history. In our first program, I thought we're Adventist Healthcare. We have 5 hospitals. We're a massive organization. So we have about 30 pediatric clinics that we partner with. So that was going to be my source. But before you write that down, after 1 month of that program, I had one referral because it turns out that those clinics work with the insured. So they don't meet the criteria that we had set for the program. So we scrambled. We ended up establishing a working relationship with some of the clinics that tailor to the uninsured. So we're working with this year. We're working with Mary Center, Mercy Clinic, and the Muslim Community Center Clinic. So we're actually working with 3 clinics that work primarily with patients that do not have insurance and could use this kind of help. I'm getting. I mean, we have about 100 families enrolled at Mercy Clinic. We got about 90 at Mary Center so far, and we got about another 30 at the Muslim Community Center. So we found our source. The families are there. We do weekly distributions, and I probably enroll another 10 families a week at each one of those sites because they see people getting food and they come over. Hey, what's this about? We have a screening tool that we do with them. It's a 2-question screening tool, so it's very short, very simple. And if they, in this particular case, our funding is through Montgomery County, so they have to have a Montgomery County zip code, have children below the age of 18, and answer yes to 2 of the questions. And I can send you the instrument that we use as well, so you have a copy of it. But that has worked incredibly well. We actually spent the first couple of weeks of the program at the clinics. So we sent a team to the clinics. These clinics are seeing hundreds of people a day. So them kind of altering their routine for us is kind of a challenge. So we set up shop in their lobby. And when they were enrolling folks, they would send them to us. And we did the interviews, we did the screening. So we were able to do everything with them. And we just, give them updates from time to time as to how many families we've gotten. They're loving it. It's the families are very happy, and they've been saying a lot of good things to the clinic. So it's good PR for us. So.
And so for clarification, so all of that work is contained in Montgomery. Has any of it made its way to Fort Washington or in Prince George's County?
Unfortunately, no. Our funding restricts it to only that county. Yeah.
And is that true for the multi-year funding as well?
So far. Yeah. Now we are trying to so I work for the grants office, so I submit a lot of grants. We just submitted to a couple of private foundations to try and expand to PG County because Mary Center is kind of on the border, and I'm getting a lot of families from PG County that are asking to join, and I just can't, and it's killing me. So I'm trying to find some additional funds so that we can help provide food for them as well.
Okay. Thank you for that.
Sure.
And then how long are folks eligible for the program? How long do you cap them off at 1 year or?
So since we go annual funding, yeah, we go as long as we have funding, we try to keep everybody, and we try to pace it. So I control the enrollment at the different sites to make sure that we can stretch the money as far as we need to go. We do have a 3-strike rule. So if families don't show up 3 weeks in a row to the clinic, we drop them from the program and bring in another family to replace them. Just because so last year we did produce bags. So we provided folks with bags of vegetables every time they came in. And we were having a lot of challenges that people just didn't recognize some of the vegetables. I mean, if it's not what you're culturally accustomed to, like, what is this? And they would come back next week like, I don't know what to do with this. So we kind of learned, all right, let's go a farm market this time. We bring a lot of vegetables. And with that, there's more waste, there's more balancing out, so things aren't left over. So it's always a balancing game. Okay, we're expecting 70 families tomorrow. Give me food for 80 or something, and we'll see what happens. And then as we enroll on the spot, we'll spend it down as we go. But farm market seems to be a lot more popular because they get to pick things that they know and things that they use. We are providing them with recipes. So we always have a table just loaded with healthy recipes to use the vegetables that were there. That way, if they're not sure what something is, I usually kind of coerce them and like, here's a bag. I'm going to give you this extra. Here's a recipe. Try this. See if you like it. Let me know next week. So we're trying to get people to kind of expand what they eat and how they eat it. So, but that's been working better for us.
I have 2 questions. The first goes to what you were just talking about, Henry, with regard, because I know like Montgomery County, Prince George's County is very culturally diverse, right? And our proposed legislation talked about food as medicine having a focus on culturally appropriate foods. And so I was curious because you just stated that, like, how do you reconcile that, or do you work with farmers to tailor with, foods? Because like our population, you know, Latinx, then you have like the um, African, West African community, Caribbean community, and so how do you all work in attempt if to your ability, right, to
Absolutely.
accommodate those things, right?
Yeah. So we're lucky that we work with a farm that grows a pretty diverse amount of food.
Okay.
And we communicate. So I actually talk to every family every week. I call every family every week to
Oh
remind them,
wow.
hey, we're doing our food distribution on tomorrow. Make sure you're coming. And they'll ask for things. So, we've had, so I'm Hispanic, I'm Cuban American. I did not grow up eating kale and eating stuff like that. And well, yeah, some of these African countries, they love kale and they were asking for it. So I think we've developed that rapport where folks are not shy about asking, hey, are you able to get this? And we'll check with the farm, and the farm usually will tell us, yeah, we'll be growing that. That'll be coming out in August. It depends by the growing seasons as well, because they do plant things based on temperatures and that sort of thing. But as an example, I had this Muslim woman yesterday. She's been asking me for okra. So what we do is we give them $30 to spend at our farm market every week. And what I let them do is if you don't see everything you like, you can carry a balance over to next week and we keep track. And this woman had already a balance of like $80 because she was waiting for the big hit on something specific. And she finally told me, the day you have okra, I want it all. So I told the farm, hey, we have somebody who really wants okra. If you guys can, manage some. So they gave me a container just of okra for her. I got the biggest hug and kiss and everything. She was so happy, and she took all of the okra and we spent the balance down. But they ask for it. They will ask for it. We do have a lot of families that come in and they don't take anything. And we ask them why, and sometimes like, yeah, I got it at another farm market, so I've already got this at home. So they are very mindful of not taking more than they're going to consume, which is very nice as well. I always assume, I'm going to take as much as you can, and you figure it out later. But the families have been really conservative, and if they already have some of those things at home, they'll leave them behind. Like some of the shelf stable boxes, they've left things for me. They're like, no, give it to another family. I've got like 3 of these at home. So people are not shy about being vocal about what they're looking for and what they want. And we try to cater to it as best we can.
Great. And then my next, and I like that you guys do give options and do have flexibility if because it's seasonal growing and based on availability. So that's really helpful. The other question I had, because I did hear you state that it's only for Montgomery County and any eligibility. I was curious to see if you guys have any linkages with the Primary Care Coalition and Montgomery Cares, because I know they have a huge child population, but they also have eligibility criteria for that program. So I didn't know if there was any type of intersectionality between the two.
I'm still relatively new to this to the food environment, so I'm still
Mm-hmm.
meeting people as we go.
Mm-hmm.
Um, so if you got anyone you could introduce me to, I would love to talk to them. I'm
I
constantly
do.
looking to expand. Okay.
Yeah, I do because just real briefly, not to deviate the conversation, but when you stated that, I thought it would be a good thing. So Montgomery Cares is a program that really addresses in Montgomery County their underserved population, right? And so essentially, they enroll family, adults, and children into a program where they can go to federally qualified health centers or providers in the community and essentially get primary care services. And these individuals definitely probably would meet your criteria, although I'd welcome you to match it and see what it is. But I would think that that would be, an opportunity for linkages if it's not there. Um, Sounds like, additionally, as you're thinking or expanding into what would it look like, because I would love to see the eligibility criteria and how you guys measure whom gets in and what needs to happen. So I think that was some of my earlier thoughts too. Like, well, how is that determinative? Like, is it like income based, magi based? household based? Does it need, so those kind of things. Is there like some type of cost share or contingency that individuals have to pay in to get into it? So I will definitely share with Taylor that point of contact information. She can outreach to you. But when you're thinking about Prince George's County, we do have a not the same. We're trying to build a program that's in its equivalency to a degree, but very much on a smaller scale. But like that partnership with those local based providers and communities that are gonna see those same people. Like we're all like our FQACs are very active in that population. And I know you know about Mary Center, and we have like Greater Baden here, La Clinical de Pueblo, and others. That serve our communities. And so how can we link it in? So if that's not where you are, like I'd be interested as you're developing it if there is going to be some linkage, right? Because you said like, hey, I thought I would get all my referrals from my own network and it didn't happen that way. So just curious, but those are the two questions that jumped out at me.
Yeah, I'm all about collaboration. That I think that makes it, and us being new to this food program is, you got to bring people who know what they're doing. So our first run at it, we partnered with the Seventh-day Adventist Church. That was our drop-off location, and we just did distributions from there. We partnered with a farm, and we partnered with a group called Community Cheer, who helped us do the surveys with our families. This year we've expanded, so I started reaching out to everybody. I'm like, we can do this. We're going to make this bigger, and we're going to make it better. So now we're partnering with the same farm because they were amazing. We're partnering with Manna Foods, we're partnering with Giant Foods, and we're partnering with the 3 clinics that I mentioned. So we are definitely expanding the umbrella and trying to get as many partners in as we can. What did end up biting us a little bit is obviously, you guys know the county, where there's limitations to how much they're willing to fund. So we asked for a certain amount and we got less than that amount. And with all these partners, then everything got thinned out pretty roughly. But Manna Foods, they stepped up and they contributed $24,000 to our project in food costs that they're going to submit. And then we're doing a lot of the work in kind so we could use more of the money for food. So, everybody's kind of stepped up and sacrificed a bit. But that kind of lets us know, all right, let's not get too lofty right away because the money's not there. So that's why I'm trying to bring in all these private entities to see if, all right, if I can get 20,000 from you, another 30 from you, this all add up, and then we can do what we really want to do. So, you gotta improvise and you gotta take all the trees and see what falls out of them. So.
And I see our esteemed Giant representative has joined us. Welcome, Leslie.
Sorry. On the administrative piece of what you're doing, do you have? I missed the beginning. Do you have a team, or I heard a lot of we're in the lobby. We take care of. We let monies roll over. If you want okra, we've made a checkbox for you. There's a lot. Sounds like there's a lot of manual intervention. How are you guys keeping up with all of that from all the different locations at which you're serving folks?
So I'll be honest, I handle most of it. So I am at every food distribution. I call every family every week to remind them of their appointment. So I am running around like a crazy person getting a lot of this done. But folks here at my office have really stepped up, and I have a lot of volunteers that come and help. So as an example, last week was the week that we do the monthly box and the vegetables. So we're handing out frozen fish, we're handing out boxes with shelf-stable food, we're handing out vegetables. I had 3 people from the office like, hey, I'll volunteer, I'll show up. And our food distributions are 2 hours, so it's not a huge time commitment in that sense. So we're managing, but as far as administrative tracking and keeping track of everything, that's my office. So it's myself and 1 employee that helps me. But I also oversee the research department. I can occasionally steal somebody from over there to help me keep track of things as well. But we do a rotation so nobody burns out, because being out in the hot sun for 2 to 3 hours a day can get a little rough. But I got my tan back, which makes me really happy. But I'm out there all the time. So the farm sends a person for the farm market that's always there. So they bring the vegetables. We help them set up the tables, and we've got it down. So they do the counting of how much everything equates to, and I'm checking them off on the list next to them. And we kind of figured out a process that works for us. It's not particularly complicated, but yes, it does put a strain on a couple of individuals that have to do everything, but that's okay. At the end of the day, you feel really good about what you've done, so it's worth the effort.
Good to know. Good to know.
Sure.
Thank you.
But ideally, I would say yes. If there was more money for more staffing, I'm sure most organizations would appreciate that. We're a big organization, so I think we have some flexibility built in, but I think some of the smaller ones, I don't think they can afford to give somebody's time up to do a project and not get reimbursed for it. So, you talk to a big one or a little one, I think the answers are going to be a little bit different.
And I heard you earlier, you talked about an organization who does the surveys with the families. Are those tracking actual health outcomes or just their experience with the program?
It's so we are asking about some health. We're asking more about their consumption and what they eat.
Okay.
We've stayed intentionally away from the health aspects of things. There's some issues about privacy concerns, especially when clinics are handing you over patient data. So there's PHI being exchanged. There's agreements that need to be signed. And I always thought it was going to be a bit of a stress. Ideally, I would get blood tests when you start the program, design this big diet for everybody, follow through, and then at the end of the program, get blood results and let's see what happens. I don't think that's realistic. I think many of the families, the thought of going to the doctor is another expense that they can't afford, and they'd rather avoid it. I think once you give food to a family, it's hard to, and I come from a research background, it's really hard to track who ate that food. And did you prepare it the way that we told you? And, so I tried to stay away from doing that hardcore, okay, let's see how the health outcomes have improved. So what we are tracking is, how many times a week do you eat vegetables? How many times a week have you offered your children vegetables? Describe the size of your plate. Like we have a bunch of questions more geared about what we're hoping we see is people are eating more fruits and vegetables, staying away from some of the things that, you were told not to eat, and processed foods and that sort of thing. We do ask about any health conditions, whether you're diabetic, whether you are obese, any other things that they may have been diagnosed with that we should know about. So we do follow up with that, but we don't get to the point where we're collecting blood samples and that sort of thing. We just didn't think that would be feasible with this population.
And to your knowledge, so it's Adventist or the actual clinic, are they screening for additional social determinants of health other than food insecurity?
I believe the clinics do.
Okay.
I believe the clinics do. Obviously, for ours, we've limited to the hunger side of things, but the clinics definitely do. I think it's a requirement at this point, if I'm not mistaken.
Okay. Yeah, I'm curious, like, how are you keeping track of everything, of all of the families who are being referred across 3 clinics and, who's coming to each appointment? And you said after 3 appointments, if they're missing, you have that tough chat with them. How are you tracking all of that?
I have this very colorful spreadsheet. When they come, the box goes green. When they don't show up, it goes red. And when you see 3 in a row, so whenever there's a red, we'll do a numbering system and we'll see as they add up. And so it's not that complicated. It's just we have their names, their phone number, the number of children in the family, their zip code, and then we have columns for each date that we do a distribution at that clinic, and we just mark them up as we go. And let's see if I might be able to show you something.
And just to understand, so is it if they miss 3 food distributions, or is it 3 actual visits to the clinic?
3 food distributions.
3 food. Okay, that's helpful. Okay.
Yeah, because when we expect, and when I call them, I would typically ask them, "Are you coming tomorrow?" We want to be real specific, and most of them say yeah, but some will tell us, "No, I can't make it," so we won't count that day against them. So that won't hurt. If they let us know, then I'm not ordering food for you. But if you're telling me every week that you're coming and I keep ordering food and you're not showing up, that food, luckily we get to enroll folks on the spot and we end up giving it to other new families. But, there could be days where we're stuck with a lot of food that we don't have anyone to give it to. So we try to avoid that scenario.
And what is that 2-hour block? When do you do your food distributions?
Right now, we do Mercy Clinic noon to 2 on Tuesdays. We do Mary Center on Thursdays, same time, noon to 2. And we do the Muslim Center on Saturdays at 10 a.m.
Did you solicit feedback from the community as to what days of the week or times they preferred or were most available?
We did. So when we enrolled the families, we have a baseline survey that asks them what days of the week are best. We provided a lot of slots of when we could do it. Is mornings preferred? Is it noontime? Is it in the afternoon? The challenge we had is the farm. The farm is the one that brings the vegetables to locations, and they're basically like, look, this is when we can do it. So that created a challenge. I'm hoping if we are able to get this refrigerated truck, that will give us some flexibility and we can actually do different times. But we are getting show rates of about 85% per week. So they're showing up. So this time seems to work. I think a lot of them are just not working right now. A lot of them will say, oh, I got a job cleaning houses. I can't come this week. And then next week they're available again. So I think that the jobs are not as consistent and they do tend to have a lot of children. So I think somebody's staying home taking care of the kids. And that's where we got. I've actually also do some deliveries as well. So there's some families that are close to the clinic. At the end of the day, I've been doing drop-offs and swing by the houses and giving their bag of food. So, we're trying to find ways to get things to people.
Kind of to that point, and another follow-up, I was wondering if these locations, I'm not really familiar with Montgomery County, but are these locations where you have these food distribution sites, are they located near public transportation, or are they just easily accessible that way?
The Mary Center, yes, they have a bus stop right in front of the place. So that's been helpful. It's funny, Mercy Clinic, there is no bus near there, but we have the best turnout there. People do not miss there. They come every week. And if they're not coming, I get calls in the office. Hey, I'm not going to be able to make it. Can you hold it? And usually I'll just double them up the following week. So my rule is if you tell me you're not coming, you can have twice as much the following week. If you just don't show, you lost that one. And people are really sticking to it, and they hold me to it too. You told me you owe me my extra $20. I'm like, I got you. So the public transportation, I don't think has been the cure-all, I guess. They're finding ways. We do have the flexibility built in. If you can send a friend and they've got your name and your phone number, we'll give them the food for you and you can go pick. So a lot of people send friends, and and a lot of the families, they know each other. So I have one come, hey, I'm picking up for 3 people. Names, here are the phone numbers. Okay. And then they'll collect everything, and they're resourceful. They figure it out, and they find ways to get things.
This is Leslie again. It sounds a lot like your same setup as Martha's Table. And many times a lot of families will pick up for one another. But the one thing I will say, and I thank you for kind of saying this out loud, is the 3 strikes and you're out. Many times, because for retention and for needs of others, I think it's a very important piece. And sometimes we feel empathetic and we feel as though we're being mean if we say no. And because there is so much need, I think it's a very important and poignant part of your programming that you do give those 3 strikes, because it's something we don't like to talk about, but we know it happens. And retention is important, and continuity and orders and, the provision of food is very, it's based on availability. And I think that that's a very good point for your programming. I still think your spreadsheet is probably really, really big and cumbersome, and you're being very nice about it. As a person who's administered these types of programs, so I appreciate the work that you're putting in.
So I will say what the 3 strikes gets you is I'm not going to call you to remind you anymore. And I'm not ordering food for you. But we've had families that they don't show up for 3 weeks, and then 2 weeks after that, with no call, no nothing, they show up. And they want food. And I'll give them food. I'll give it to you. If I have it, it's yours. So what I'll typically tell those families, like, look, I wasn't expecting you. We're here till 2 o'clock. Come back at 2. If I have anything left, you're welcome to it. So, we have a system worked out. So if you need it and we have it, it's yours. So I'm not going to tell you, no, I'm sorry, you can't have it now because you missed all these dates. But we do okay, you kind of move to the end of the line. And if we do have it, we'll give it to you, but we can't take it away from somebody that we're expecting. And they're very understanding. And oftentimes they will stick around till 2 o'clock. And, in most cases, they'll get some stuff. So that's worked out well.
And my second question is around grant funding. You mentioned that you do a lot of writing for grants. Are you finding that those opportunities are there as they were previously, or has programming become, I've heard from a lot of different organizations that they have to get extremely creative in order to get a granted funding from extreme programming that's different and exclusive to, the different types of narrowing the population. So it's so specific that almost it's unreasonable to have programming. Are you finding that in your search as you search for funding?
We are having challenges finding foundations that fund food insecurity. I mean, that's like the hot button topic these days. Food insecurity is like they slapped out on everything. But we've probably found about a handful of organizations that fund those things. And as an example, I applied to one asking for, winter money to try and provide food in the winter. And they're like, I can't give you food, but I can buy you a truck. I'm like, what? Let's get a truck. So yeah, so they even pivot you. And I think, and as a grant writer, I'm definitely pivoting on the fact that, look, we've had this program for 2 years. We've served almost 250 families. We have this ongoing weekly thing. So I'm selling like, hey, we have a program, we're established. We have these partnerships with all these great organizations, and throw that around and see what it gets you. So, but yes, there's only about a handful. A lot of the foundations are, especially the private ones, they're very specific to areas where and I'm just going to throw out like Wawa, for example, they do provide food money for certain things, but there needs to be a Wawa in the neighborhood. They'll only fund things where Wawa people live or Wawa employees live, that sort of thing. So there's a lot of those restrictions that are very, they have great opportunities, but it's only in communities that their employees live in or where they have a headquarters or that sort of thing. So that is very limiting. And then also being in Maryland, I mean, all the money goes to Baltimore. That's also another challenge.
Yes.
If you're not in Baltimore,
yes. They have a ton of programs in Baltimore City in particular.
Exactly. So they definitely get the bulk of the funding that is available out there.
And I'm just curious, Henry, how it was kind of bringing all of these partners together, educating folks on food as medicine programs, getting folks up to speed, speaking one language. How was that rollout? And, how much time did you budget for that? I know you said there was a bit of a delay, from the time that money, came in, and then it was out of crop season. So how was that getting everyone up to speed about food as medicine programs?
I mean, most of the partners that I'm working with, they're from the food environment. So Manna, they do food education, so they all know that stuff. They distribute food to thousands of people a year. Our farm, they grew vegetables. They weren't so keen on the food as medicine concept, so there was definitely some education there. But the way we've kind of structured everything is everyone's kind of compartmentalized to a certain extent. So the farmer doesn't need to know a whole lot about a food as medicine program. I just need to get vegetables on a steady basis. Manna handles our nutrition education. They're working with Giant Foods as well, and they work with some of our nutritionists here that work with our diabetes patients. So I'm putting the people that kind of know one thing together. So all the nutritionists, all right, you guys go have that. And I'm the odd one in the room that's like, okay, what are you guys talking about? But I think everyone's got, some base knowledge about it. I've done a lot of lit searches to kind of see what programs are working. And there's just all kinds of programs. There's some that they've set up refrigerators at the clinics and people can just grab things out of refrigerators. I chose to do, so my background is more running community-based programs. So that's kind of what I wanted to do. I didn't want to just leave things. I want to be hands-on. I want to engage with the families, and I think those relationships are valuable. We have a lot of families that come get food and they volunteer as well. They come back and they help us distribute stuff, and they help us with anything we need help with. So it's building that community and trying to get everyone engaged. But I think everyone that we kind of brought to the table had a pretty good concept of what food is medicine, but I think everyone interprets it in different ways. Like what I was talking about earlier, that, some are really on the medical side. We want to get blood samples. We want to make sure that, your LDL is down and this is up, that sort of thing. Whereas I'm probably a little more focused on food insecurity and our dietitians basically say, look, the diet that we're talking about, the foods we're providing, that's what we would prescribe to a diabetic, to somebody who's obese, to, a whole host of conditions. So in theory, we're providing them what we provide on a one-to-one basis. So we're still trying to provide, and that was eye-opening to me too. I'm like, that's a good point. It really is pretty much the same thing. Eat more vegetables, eat less of this. And so I think everybody kind of knows, everyone's done things a little bit differently, and I think so. We've had partners that we've had meetings, and I came with, since I'm the lead, I'm kind of, look, this is what I want to do, this is how I want to do it. And we had some partners that weren't on board, and they're like, yeah, it's too different from what we do, or it doesn't fit the model that we've been doing. And it's okay, we'll part ways, and maybe further down the road we can do something different, but it's not for everybody. And yeah, I think having somebody in the lead that kind of has the vision for how they want to do it, I think it's easier to plug in pieces. Everybody brings their expertise. Man has been fantastic. But they showed up with a tractor trailer and started dropping off pallets, and I'm like, what is going on here? So that was not what we were used to, but we learn as we go, and I think everyone's open to it. And if I can say one thing about everyone that I've been involved, is they really want to help people. So there's definitely that, and I think you can adjust the rest.
Absolutely. That's very helpful. That's something that this work group has considered. Like I mentioned before, we are um, kind of responding to some legislation that is being proposed at the county level that would require the health department to oversee, run, administer, fund food as medicine programs in Prince George's County. And so looking at that policy, at that bill that's been proposed, our first reaction was trying to boil down, what are we looking at this food as medicine program? What lens are we looking at it through? Is it food insecurity, nutrition insecurity, medically tailored meals? How are we looking at it? So that is very helpful context to have. Any other questions or comments for Henry? All right, Henry, any other advice you would offer anyone who is continuing to embark on food as medicine programs here in 2025?
Sure. I think the biggest challenge we've had is when your budgets are tied to your fiscal year. I think that can get really complicated. And our farmers always complain, like, why do they give you money when I can't grow anything? So that's something to keep in mind. So maybe a workaround is if you can do a two-year funding, even if there are smaller amounts each year, but that way we can tailor things around the growing seasons. And what else? I had something else in mind. There was something else I wanted to say that's been a challenge for us. Slipped my mind. Okay, there was something, but I can always email about you later. But no, I think these programs are definitely very necessary. Something has changed from last year to this year. Last year we had good numbers. This year it's a little bit crazy. I think, I don't know if I know you guys are government, but I don't know if it's something what's going on with the federal government, but some things are definitely a little different. We're definitely seeing numbers that we did not expect this time
More
around.
or less.
Yeah,
More or less, Henry. More people.
a lot more, a lot more.
Yeah, that's our concern. Like, it's a double-edged sword, at least from where we're sitting. So I expect, just because of the uncertainty of the economy, you're going to see more people in need, right? But also due to, like, depending on the population you serve, also am fearful that there will be a reduction of people outreaching to services that are necessary. And so, like, how we all work in tandem to support that is going to be very, very tricky, I think. But yeah, it'd be interesting as you go on or as the year goes on, like if we could circle back. I know that our county council is bringing this up for review in early September. And we'll see where it all lands. But I would, if possible and feasible, would welcome the opportunity to come back once we know where they've landed and settled. Because there's a couple of proposals that have been thrown out, but I don't know where it's all going to land. So once we know which direction the county council desires us to go and whatever is actually passed, I'll be very interested to come by and maybe even see it. Like on your, I know it's probably like you run around with your head cut off, but I would love to see it in action. And
You're welcome
maybe even,
anytime. Yes.
yeah, and maybe even propose that to some of the council members too, because I think it's really right now like you're an agency that kind of can house it right now. The current legislation is looking like they want us to manage it, and I don't mean manage it like we would be the distributors per se. We probably will partner with a vendor such as yourself, but just all the nuances because it doesn't feel like a one size fit all. It's like you work with the local farmers, you work with the grocers, you work with, all those things. And I know they said that, but like trying to really outline the whole program structure would be really good or helpful for me to see. So anything you could share as I'm just in the fact finding stage would be great if you could share with Taylor, and I'll share the information for the Primary Care Coalition with her today. But it was great. I learned so much. Thank you for
You are
your
officially
willingness.
invited any Tuesday or Thursday, noon to 2. Mary Center is
Okay.
really close to where you guys are.
Okay.
I would say maybe we could align it on a day when Manna is dropping off the food boxes as well, because
Okay.
it's a lot of moving parts. I mean, they're bringing pallets, and we got the farm setting up tables and so it's a bit more of a runaround, but it'll give you a good idea what
Okay.
things look like. And the families, that was probably the 2 days that we've had the best turnout. Because I tell them on the phone, we got extra stuff for you today. We got a lot of good stuff. We got fish for you. And they're like, fish? What? So it's, the little things, but absolutely. We have a site visit scheduled sometime in the fall. We're still ironing out the details with OFSR, which is our sponsor. That might be a good opportunity for you to come as well. So you can talk
Okay.
to the Montgomery County folks that are funding this. Maybe you guys can share ideas and get to know those folks as well.
Awesome. All right. Well, I'll lead it to our fearless leader Taylor, and I would love to be a part of it. Thank you. Taylor, I'll turn it over to you.
Yes, thank you. Thank you, Henry, so much. This was a hugely beneficial conversation for us just to, again, learn from your model. We've gone through a few food as medicine programs and just understanding, again, how everyone does it, how everyone reaches the population that they seek to serve. So thank you so much for your time. I will be in contact to follow up, and let us know if you need anything. You've got some great content experts, also some folks who access food as medicine programs at different points. So you've got Giant on the line, Food and Friends, the health department, of course. Let us know how we can be of support to you.
Absolutely. I appreciate that. And thank you
And
all for
thanks
the
for
time.
everything that you do.
My pleasure. It was great to meet you all. But I'll stay in touch, and I'll let you know whenever you all can come, whenever you want to come out. Just let me know. We will set you guys up. All right.
Absolutely. We'd love that.
Yeah.
Thank you, Henry.
Yep.
Thanks so much.
Thank
Have a great
you.
day.
Bye.
Take
Thank
care.
you.
Bye.
All right, thank you.
Everyone.